Today, we're diving into one of the most heartbreaking and urgent issues in medicine: suicide amongst healthcare workers.
So I was married to an oncologist for 20 years. Was like the happiest guy you ever met. And, I tell people all the time, my husband went to work every single day to save lives. And the fact that he took his own is just simply hard to comprehend.
Was there any part during you started realizing that something was happening, like when you were with Matthew, or did you have any inkling of how depressed he was?
He never really struggled with depression. No, I mean, that was what was so shocking. It was just like this total shutdown. He had a non-compete in Minneapolis where he left, and a non-compete in North Carolina. So that created a very stressful feeling for him, like he felt like he was trapped. The night before he died, he had become suicidal and he ended up in the ER. And then they sent him home with a sleeping pill. There were 1,000 people at his funeral thinking, what the heck happened to Dr. Gall? And I think, he went into healthcare to help people. So he had a very big heart. And I think every single little patient death took a part of his heart. I think being a physician killed my husband.
Men are supposed to be strong and men are supposed to not cry.
That they would actually cross state lines and then pay cash and use a fake name. I mean, that's ridiculous. Do you think that John's wife is mad at me? And I stopped and I was like, man, like, they loved you. You're not God. You can't save everybody. He took every little thing so personal. And that broke my heart because I thought, wow, this is a lot deeper than I can even imagine. Do you ever get mad at him? And I said, I wouldn't get mad at Matthew if he had had cancer. So I'm not mad that he got depression.
That really breaks my heart too. Yeah, but it's so true.